Everybody. So welcome to this lesson we're going to talk about peripheral nervous system or the PNS. And today we're going to explore the PNS's role in connecting the brain and the spinal cord to the rest of the body. And we'll learn about sensory receptors and cranial and spinal nerves, reflexes, and some common disorders that could be associated with that. So in this lesson, we're going to compare cranial nerves and spinal nerves and learn about the peripheral nervous disorders. We're going to discuss two divisions of the autonomic nervous system and the sympathetic and parasympathetic systems. And we're going to identify common disorders of those autonomic systems. So the PNS acts like the body's communication network, right? So it includes sensory receptors, nerves, ganglia, motor nerve endings, and all these components, they send signals to and from the brain that enable us to sense and respond to the world around us. Okay, so sensory receptors. Receptors are specialized structures that respond to changes or stimuli in the environment. They convert those signals into nerve impulses, like we talked about last week, and send those impulses to the brain. Then the sensation is the awareness of that stimuli, and perception is understanding the meaning of that stimuli. So if you look on your slide, awareness of stimulation equals the sensation, and then interpretation of the meaning of the stimuli is perception. And both sensation and perception happen in the brain. So there are three ways to classify sensory receptors. We classify them by the type of stimulus, the body location, and then the structural complexity. So we're going to start by talking about the classifications by stimulus type, okay? So receptors are classified by the type of stimulus they detect, okay? So the mechanoreceptors, they sense touch, pressure, stretch. Thermoreceptor Thermoreceptors, they detect temperature changes. Photoreceptors respond to light. Chemoreceptors, they detect chemicals, so that would include taste and smell. And the nociceptors they sense pain, such as extreme heat or cold. And then when we look at classifications by location, you have your exteroceptors, which those detect stimuli from the external environment around us, right? Such as touch or temperature on your skin. Interoceptors or visoreceptors, they monitor internal conditions like your blood vessels stretching or chemical changes, hormone changes. And then you have your pro, proprioceptors, which provide feedback on body position and movement found in your muscles and your joints. All right, so some receptors are simple and they're found throughout the body for general senses like pain or temperature, but others are very specialized and they're located in sensory organs. So, like your eyes, your ears, for vision, hearing, balance, Those ones are very specialized. So nerves, we talked about last week, talked about nerves and ganglia, but those nerves are bundles of those axons, right? Surrounded by those connective tissue layers that we talked about. Um, you have your endoneurium, which wraps around each individual axon. Your perineurium, which is a group of axons, and then it is surrounded by the perineurium, which is called the fascicle. And then the whole group is called of the nerve is enclosed by the epineurium, right? We talked about this last week. And then we have bundles of myelinated and non-myelinated peripheral axons enclosed by those connective tissues. We talked about what myelinated and unmyelinated was last week. And then you have two types of nerves. So you have your spinal nerves and then your cranial nerves. And so that just depends on where they originate. All right, so nerves can carry sensory signals, which is called afferent to the brain. No, I talked about the endoneurium, perineurium, epineurium, and on that last slide. We talked about that last week as well. All right, so here we have where we're going to talk about what the nerves sense, right? The structure and the classification. So we're going to be talking about afferent and efferent, somatic, autonomic, visceral fibers. Okay, so sensory is your afferent nerves. Okay, and that send impulses to the brain, to the CNS. Your motor is efferent, and they send impulses away from the brain to your muscles. Okay, so to find purely sensory or purely motor nerves is pretty rare. Most nerves contain both sensory and motor fibers. And we're going to talk about this, which nerves have both, nerves have either one or the other later on in this PowerPoint as well. So the types of fibers in the mixed nerves, right? So you have somatic, which is sensory from muscle to brain. So somatic afferent from the brain to the muscles, sensory. Somatic efferent is motor from the brain. Sorry, I said them wrong from the beginning. Okay, so somatic afferent, sensory from muscle to brain. Somatic efferent is motor from brain to muscle. Okay, the visceral afferent is sensory from organs like your heart to the brain, and visceral efferent is motor from the brain to the organs. Okay. So somatic, think of more on towards the outside of your body, right? Muscles. Visceral, think inside, internal organs. All right, so cranial nerves, there are 12, and these are going to be very important to remember because you will be talking about all these cranial nerves multiple times throughout this program, okay? So the nerves connecting the brain to the spinal cord and then to other parts of the body are all considered the PNS, the peripheral nervous system. And the system includes your cranial and spinal nerves, and that connects the brain and the spinal cord to your peripheral structures such as your skin, the surface, skeletal muscles. And then in addition, any other structures in the autonomic nervous system, the ANS, which we're going to talk about in the next PowerPoint, are considered part of the PNS as well. All right, so here is an illustration of the cranial nerves. Okay, so you'll want to definitely know where these are located. So this figure shows the view of the under surface of the brain, and it illustrates the attachments of the cranial nerves. So again, there are 12 cranial nerves, which primarily serve the head and neck, but each nerve has specific functions. So some will control eye movement, some control facial expressions or swallowing. Only the vagus nerve, which is 10, extends into the abdomen. Here's another illustration and view of where those nerves are located within the brain. So our first nerve is the olfactory nerve, okay? And it's responsible for sense of smell. So to test this, a subject is asked to identify aromatic substances like coffee. Okay? And damage can result in anosmia or the loss of smell. All right, so the second nerve is the optic nerve, and this nerve controls your vision. So testing this would include eye charts and checking your visual peripheral field. Damage can lead to blindness or visual defects, and it's called anapausias. All right, so the third one is the ocular motor nerve. So the function of this motor nerve is responsible for eye movement. So our eyes being able to look side to side, where your optic nerve is vision, right? What you see, not where you're looking. So the third one is actually where you're looking, moving the eye, okay? It controls 4 of the 6 extrinsic eye muscles, the superior rectus, inferior rectus, medial rectus, and inferior oblique. It also controls the pupil constriction or dilation, um, which that movement is considered a parasympathetic function. And it also gives sensory feedback about the eye position. Testing for this, you're going to ask the patient or the subject to follow an object with their eyes, right? So put a pen or your finger, pen light test to test the reflexes. Injury, damage results in eye movement paralysis, causing the eye to remain in a fixed position and inability to move up, down, or inward. Okay, so nerve number 4 is the trochlear nerve. This is a motor nerve, and it controls the superior oblique muscles of the eye, right? Which allows the eye to move downward and laterally. Testing along with the ocular motor nerve is by observing the eye's ability to follow moving objects. Damage can result in difficulty moving the eye downward or laterally, and it can also lead to double vision. All right, so trigeminal nerve 5. This one is probably is the most important one in dentistry because it does affect a lot of the teeth and the motor functions of the mouth. Okay. So it is a mixed nerve and it has three branches. So you have the ophthalmic, the maxillary, and the mandibular. Okay. For sensory, it provides sensation to the face. For motor, it controls the muscles involved in chewing. To test it, we check sensation by lightly touching areas of the face. And then to test the corneal reflex by gently touching the cornea with cotton. And then you have the subject clench their teeth. So those are things that we're testing, that how you test that nerve. For injury, inflammation can cause the trigeminal neuralgia, which is characterized by an intense facial pain. Okay, so you want to keep this image throughout this program. You'll be referencing it. You will need to know these nerves specifically, especially when you get into pain management, because these are the nerves that we're going to be giving anesthetic to numb the teeth. So this nerve is of particular importance to know in this program. All right, so nerve number 6 is the abducens nerve. So it's a motor nerve. It controls the lateral rectus muscles that are responsible for moving the eye outward laterally. Testing it, you're going to ask the patient to follow the moving object with their eyes, and damage causes the inability to move the eye laterally, and the eye may turn inward when at rest. All right, so facial nerve number 7. So this is also a mixed nerve. So the motor function controls facial expression and stimulates lacrimal or tears and also salivary glands. Okay, so that's also really important in dentistry. And it also the sensory part of this nerve provides taste sensation to the front 2/3 of the tongue. So taste, salivary glands, tears, facial expression is all within the facial nerve. And even though this nerve has, a lot to do with dentistry, this nerve is not one that we would be trying to anesthetize. So in pain management, we're focused on nerve 5, but facial nerve is important to know because it does have so much function with the oral cavity. To test this nerve, you're going to check facial movements such as smiling or frowning. You can also test taste on the front part of the tongue with sugar or salt solutions. Injury, damage, damage to this nerve can cause Bell's palsy, which is a condition involving paralysis of the facial muscles on one side. It's usually due to viral infection. However, there is one injection, or there's a few different types of injections that we give with anesthetic that can get close to this nerve, especially around the eye, and it can temporarily cause paralysis to that nerve while it's numb, while there's anesthetic there, and the patient could have temporary Bell's palsy, but she'll talk about that a lot more in pain management. But it is important to know where this nerve is so that we can avoid causing that for a patient. So this is a really good way, especially this picture of the little boy with the hand. That's a really good visual way to see where those nerves are within the facial um, branches. Okay, so we have nerve number 8, which is the vestibular. This is a sensory nerve that has two branches. The vestibular branch, which is responsible for balance and equilibrium, and the cochlear branch, which is responsible for your hearing. Okay, so how they test for this, they use a tuning fork to check the hearing, and then they also look for nystagmus, which is involuntary eye movement to assess balance. If there is injury to this nerve, damage can cause deafness if it's done to the cochlear branch, or dizziness, loss of balance, nausea if it's damage to the vestibular branch. And this is an illustration of where those nerves are. All right, so now we have nerve number 9. This is the glossopharyngeal nerve. So this is also a mixed nerve. So your motor function is going to elevate the pharynx during swallowing. Okay. Sensory is going to provide taste to the back 1/3 of the tongue, and it also monitors blood pressure and oxygen levels. How we test for this nerve is we ask the patient to swallow, and then we can also test the taste on the back of the tongue. If there was any injury or damage to this nerve, the damage could result in impaired swallowing and loss of taste on the posterior part of the tongue. Okay, so now we have nerve 10, which is the vagus nerve. It is also a mixed nerve. The motor part of the nerve controls the muscles of the pharynx, so swallowing, the larynx, which is your voice box, and it provides parasympathetic signals to your heart and lungs and your abdominal organs. Okay, so the sensory part of this nerve provides sensations from internal organs. Okay, how we test for this, you test alongside with the glossopharyngeal nerve by checking swallowing and also the gag reflex. If this nerve is damaged or injured, damage can cause hoarseness, loss of voice, or issues with heart rate and digestion. All right, so nerve number 11 is an accessory nerve. It is a motor nerve. It controls the trapezius and the that's the CMS muscle. So that's what enables your shoulders to shrug and your head to rotate. How we test it is we ask the patient to shrug their shoulders against resistance. If this nerve is injured, damage can cause difficulty in shrugging your shoulders or turning your head in the opposite direction, to the opposite side. Then we have nerve number 12, which is the hypoglossal nerve. So this function of this is motor nerve. It controls the tongue movement, essential for chewing, swallowing, and for speech. To test this, you're going to ask the patient to stick out their tongue, and it should be straight. Okay. Injury, if this nerve gets injured, damage can result in difficulty speaking or swallowing. If one side is injured, the tongue will deviate to the damaged side. And again, yes, you will see cranial nerves again in this program several times. So you do want to pay attention to this chapter. So things to help you remember what function those nerves have. Okay. So primary function is either going to be sensory, motor, or both. So here's some sayings that can help you to remember which of those nerves does what. Okay, so you can either say, some say marry money, but my brother believes it's bad business to marry money. Or another version is, some say marry money, but my brother says big brains matter more. This is how you can compare that. Okay, so some for number one, olfactory, is sensory. Say for number two, sensory. Marry for number three is motor. Money, number four, motor. But is both. So the trigeminal, number five, is both sensory and motor. Okay, so you can see how that goes. So if you just remember that saying, write out 1 to 12. You can write out the first letter of each of those words in the saying, and you will know if that corresponding number is sensory or motor or both. We have here this table. So the first letter of each word in the following sentence will correspond to the first letter of the cranial nerves in ascending order from 1 to 12. So there's two different sayings here, right? So, oh, once one takes the anatomy final, very good vacations are heavenly. So you can see, oh, once one takes the anatomy final, very good. Go back. Very good vacations are heavenly. So you can see it follows each of those names of the nerves. You can also, another saying, if that one's hard to remember, on occasion our trusty truck acts funny, very good vehicle anyhow. Okay. This this chart at this table is very good though, because it shows where the impulses are going. Is it going from the brain or to the brain, right? So olfactory is from the nose to the brain, optic from the eye to the brain, oculomotor is from the brain to the eye, and then it tells you the functions. So what it does, sense of smell, helps your vision, helps eye movements, right? So this is a very good table to know and to memorize. Um, Here's another thing that you can think of as you are pointing to each part of your body. This is in order as well, right? So number one is smell. You smell something, it's olfactory. Number two, you see it, optic. Move your eyes, oculomotor. So this is just an easy way of you maybe being able to physically point to on yourself and do the movement of what those nerves do to help you remember them. All right, so moving on to the spinal nerves. So there are 31 pairs of spinal nerves that connect the spinal cord to the rest of the body. And these mixed nerves, they carry sensory and motor. So sensory input, motor output, and each nerve serves as a very specific area of the skin, right? And that is called a dermatome, okay? So in this figure, we're looking at the very specific areas of the skin, which is called the dermatomes. It's segmented by the dermatome distribution of the spinal nerves to the front and the back of the body. So you can look at each of those different segments. C is the cervical segment. T is the thoracic segment. L is the lumbar segments, and S is the sacral segments. And then CX is the coccygeal segment. So each spinal nerve corresponds to that very specific skin region. And this is very helpful for diagnosing nerve damage by assessing sensation in those areas. Sure. All right, so unlike cranial nerves, spinal nerves do not have special names. Instead, they have a letter and a number. So, for example, you have C1, that's the first pair attached to the cervical segment, okay? So, after exiting the spinal cord, from some spinal nerves, they form networks called plexus. So, for example, you have a cervical plexus, which serves your neck and shoulders, and then you have a sacral plexus, which includes the sciatic nerve, which is the longest in the body, and it serves the legs. So when we look here, we can see that very first one is the cervical plexus. That would be C1 through C4. It supplies the neck, shoulders, and diaphragm via the phrenic nerve. You have your brachial plexus, which is C5 to T1. It supplies the arms and hands. You have the lumbar plexus, which is L1 to L4. It supplies the lower abdomen and thighs and hips. And then you have your sacral plexus, which is your L4 to S4. It supplies your buttocks, legs, and feet. All right, so each spinal nerve supplies a very specific area of the skin called the dermatome that we talked about. Okay, so those dermatome maps are very useful for diagnosing nerve damage based on loss of sensation or pain in that specific area. And the close relationship between the source of the spinal cord and each spinal nerve and part of body and nerve aids allows doctors to identify the site of the spinal cord or nerve damage by using pinpricks. So they'll prick different parts of the skin to determine which spinal cord they need to look at. Okay. But each spinal nerve is connected to the spinal cord via two roots. You have ventral roots, which have the motor function, and then you have the dorsal roots, which contain that sensory function. We're going to look at these a little bit more. All right, so each spinal nerve, again, it connects to the spinal cord by those two roots. So if we look in this figure, you have your ventral root, which is your anterior root. That contains your motor or your efferent fibers, okay? These fibers originate from the motor neurons in the ventral horn of the spinal cord, and they transmit signals from the brain to the muscles or glands. Then we look and you can see the dorsal root, which is the posterior root. It contains your sensory or afferent fibers. So these fibers transmit signals from your sensory receptors in the body to the CNS, okay? So your ventral root is sending signals out to the body. Your dorsal root is sending signals from the body up to the brain, okay? And each dorsal root has dorsal root ganglion. And this is where it houses the cell bodies of sensory neurons. And the ventral and dorsal roots merge to form the spinal nerve. Okay. These mixed nerves are mixed nerves. The spinal nerves contain both the sensory and motor fibers. That makes them the mixed nerve. All right, so spinal nerves in the lower spinal cord, the roots of the lumbar, sacral, coccygeal nerves extend downward through the vertebral canal, and it forms the quita equina, which resembles a horse's tail, and that's how it gets its name. So after exiting that foramen, the spinal nerve will branch into dorsal and ventral ramus or rami. So in this illustration, we can see that after leaving the spinal cord, the spinal nerve divides into those branches or those rami. Okay, so the dorsal ramus is the smaller branch. It serves the posterior body trunk. This includes the skin and deep muscles. So your ventral ramus is the larger branch and it serves the anterior and lateral body trunk and the limbs. Okay. Um, it forms the nerve plexuses and in regions like the cervical, brachial, lumbar, and sacral areas. Okay, so innervation of specific body regions. So, the spinal nerve rami and their main branches supply the entire somatic region of the body from your neck down. All right, so spinal nerves branch into rami after leaving the spinal cord. Those rami innervate specific areas of the body, like we've talked about. The dorsal rami serve the posterior body trunk, like the back muscles and the skin. The ventral rami serve the anterior body trunk, including your limbs. Key differences between roots and rami. So roots are located closer to the spinal cord and contain either the motor, ventral, or sensory dorsal fibers, and rami are found further from the spinal cord and carry both motor and sensory fibers, forming those mixed nerves. Okay, so most ventral rami form nerve plexus, which are those interlacing networks and nerves. These plexus are critical because they contain fibers from multiple spinal nerves. They they provide redundancy, ensuring that damage to one spinal nerve doesn't completely paralyze that region. Okay. The main plexuses include the cervical plexus, which serves the neck and diaphragm, the brachial plexus, which serves the upper limbs, the lumbar plexus, which serves the lower abdomen and anterior thigh, and then the sacral plexus, which serves the buttocks, legs, and pelvis. And these plexuses ensure that our body regions are innervated efficiently and they provide backup pathways in case of nerve damage. All right, so here we're looking at the cervical plexus in the neck. So this is spinal nerve C1 to C4. It innervates the skin of the neck, ear, and shoulders, the muscles of the neck, and a critical component is the um, phrenic nerve, which receives fibers from C3 to C5. And this controls our diaphragm, which is the primary muscle to help us breathe. So damage to the uh, phrenic nerve can impair breathing. And so it is a very vital nerve for our survival. And here is a diaphragm or an image of what those look like. And where you can see here where it's highlighted where the phrenic nerve is located within the neck. Okay, here we're going to talk about the sacral plexus. So it is coming from spinal nerves L4 to S4. It again innervates the buttocks and lower limbs, pelvic structures, and the perineum. It is the most important nerve. The most important nerve of this plexus is the sciatic nerve. It is the longest and thickest nerve in the body. It innervates the hamstrings, most of the leg muscles, and foot muscles. And the sciatic nerve divides into the tibial nerve, which serves the posterior leg and the sole of the foot, and the common fibular nerve, which controls the anterior and lateral leg. So, injury to the sciatic nerve can result in sciatica, which is characterized by pain radiating down the leg. And here is an image of where that sciatica, you can see highlighted in green, where that's located. And then this is, you can see this again, how long that sciatica nerve is and where it's going and what it is innervating. All right, so reflexes are automatic responses to stimuli. They can be inborn, which is intrinsic, like pulling your hand away from a hot stove, right? You naturally do that. It's very rapid, involuntary movement. It's to help you avoid pain. Learned or acquired reflex is like salivating when you smell food, right? It's a learned skill, or like driving skills. It's something that can be learned, and it's usually not quick. It takes practice and repetition and conditioning. So reflexes follow a very specific pathway. So it has a receptor which detects the stimuli. You have sensory neurons, which sends the signal to the brain. Integration center, which it processes that signal. Your motor neurons sense the response instructions. And then your effector uh, executes the responses like muscle movement. Here is just a diagram of exactly what we talked about in that last slide, how that works. So components of the reflex arc can be classified as somatic reflexes, which activate your skeletal muscles, or autonomic or visceral reflexes, which activate visceral effectors like smooth or cardiac muscles or glands, so internally. With your spinal reflexes, it occurs without direct involvement of your higher brain centers, right? So your brain is still advised of spinal reflex activity and may have some effect on the reflex. How you test how you test somatic reflexes is important clinically. So you can assess the condition of the nervous system in general. If it's exaggerated, distorted, or absent, it may indicate that there's degeneration or pathology of a specific nervous system region, and that they would want to look at that. All right, so lumbar puncture is also called a spinal tap. It's a normal sample of your CSF from the lumbar puncture, slightly yellowish and clear in color, but red color in an abnormal sample indicates bleeding usually, right? So it's used to reduce pressure and swelling from injury or disease, or it's analyzed for diagnosis. All right, so um, peripheral nervous disorders. So neuralgia in some cases may lead to atrophy of the leg muscles. And common disorders can include the neuritis, which is general nerve inflammation. You have your sciatica, which is pain along the sciatic nerve that we mentioned down the leg. Shingles, which is a viral infection. It causes painful rashes along the nerve. Um, Trigeminal neuralgia, it can be reoccurring episodes of stabbing pain along one or more branches of the trigeminal or fifth nerve in the head. So that fifth nerve is important in dentistry, right? So that's one thing that we want to pay attention to. Bell's palsy is paralysis of the facial features, resulting to damage to the facial or the sixth cranial nerve, which we talked about. Again, that can affect us in dentistry, and we want to know where that nerve is so we don't accidentally get it numb and cause temporary Bell's palsy. And Bell's palsy is usually temporary, but sometimes it's irreversible and can cause permanent disfigurement. Um, so herpes zoster is caused by the varicella zoster, which is the chickenpox virus. Okay. Um, it has usually what has happened, it's invaded the dorsal root of the ganglion and remained dormant until an episode of shingles, and then that activates it. Usually affects a single dermatome, producing characteristics of painful plaques or vesicles. And this is what herpes zoster or shingles looks like. Okay. This is on a 13-year-old boy with eruptions involving the dermatome T4. Okay, so just to recap, the PNS links the brain and the spinal cord to the body, includes the spinal and cranial nerves, sensory receptors, and reflexes. And understanding these structures helps diagnose and treat nerve-related issues. And I will have a list of things to make sure to study for your quiz on the next PowerPoint.